All right, let's get right into it. If you're a brand new resident, you are going to run into Venlafaxine, Effexor, almost immediately. It's a really common, really powerful antidepressant, but it's got some specific quirks you absolutely have to get a handle on. So think of this as your quick start guide to using it well and, feeling confident about it from day one.
Picture this. It's 6 a.m. You're probably not even fully caffeinated yet, and you're pre-rounding. Your attending turns to you and asks that question. Remind me, why did we choose Venlafaxine for this patient? We've all been there, right? That moment, it can make or break your presentation. And that's exactly what this is all about, getting you prepped for that question so you don't just have the answer, you actually get the why behind it.
So let's tackle that first big question. Why this drug? Out of all the options we have, why Venlafaxine? To really answer that well, we've got to start with what it's doing in the brain. Okay, so at its core, Venlafaxine is what we call a serotonin norepinephrine reuptake inhibitor, or an SNRI. Basically, its job is to block the brain's little vacuum cleaners, the reuptake pumps, for both serotonin and norepinephrine. When it does that, you get more of those two neurotransmitters hanging around in the synapse. That's what we think gives it its antidepressant and anti-anxiety effects. But, and this is a big but, here's where it gets really interesting and kind of unique. Now, this right here is the absolute key clinical pearl for Venlafaxine. You have to know this. Its action is totally dose-dependent. So at lower doses, say under 150 milligrams, it's pretty much just blocking serotonin reuptake. It's basically acting like a standard SSRI. But as you start pushing that dose higher, that's when you start to engage the norepinephrine transporter. And that's what we call the norepinephrine kick. That's often the whole reason we're using it, to get that full dual action effect.
So with that in mind, when are you actually going to reach for this medication? Well, that noradrenergic activity makes it a really strong choice in a few specific situations. It's a go-to for more severe or treatment-resistant depression, especially when an SSRI just hasn't cut it. And because norepinephrine plays a big role in energy and pain, it can be a game-changer for patients whose depression comes with a lot of physical symptoms, like that deep, crushing fatigue or chronic pain.
Okay, great. You've decided Venlafaxine is the right call for your patient. Now for the nuts and bolts. How do you actually prescribe it? Getting the starting dose and the titration right is absolutely critical, both for safety and for making sure your patient can actually tolerate it. So for most of the big indications, like major depression and generalized anxiety, you're going to start at either 37.5 or 75 milligrams a day. Now the key here, and it's really important, is to wait at least 4 days, though honestly, in practice, a full week is often better, before you even think about increasing the dose. This gives the patient's system time to get used to it, and lets you see if any side effects are going to pop up before you push things higher. So here's a really solid, step-by-step strategy you can actually present on rounds. 1. You start low, often with the immediate release, or IR form, because it gives you more flexibility. 2. You just observe. Watch the patient for about a week before you make any changes. 3. Increase gradually. You bump it up in small increments, like 75 milligrams, based on how they're doing. And then 4. Once you find a stable dose that's working, you can switch them over to the extended release, the XR formulation, which is just a convenient once-a-day pill. See? It's a safe, methodical approach that really puts the patient's comfort first.
All right, next up, and this is huge, let's talk about the patient. Your job isn't just about writing a script, it's about preparing them for what to expect. And believe me, with Venlafaxine, the counseling you do right at the beginning is absolutely essential.
You'll want to go over the usual stuff, right? Nausea, dry mouth, maybe some extra sweating. Those are all pretty common. But the one you have to flag for them is the dose-dependent increase in blood pressure. This ties right back to that noradrenergic kick we talked about. As the dose goes up, their blood pressure can creep up too. So it is vital to get a baseline BP before they start, and then to keep an eye on it throughout their treatment. But honestly, of all the side effects, the single most challenging one can be trying to stop it.
See, Venlafaxine has a really short half-life. That means it's in and out of the body super fast. And because of that, it can cause a really, really nasty discontinuation syndrome if someone stops it abruptly. You have to warn your patients about this. The symptoms can be incredibly distressing. We're talking intense anxiety, nausea, and especially the infamous brain zaps. Patients describe them as these little electric shock sensations in their head. This is exactly why a slow, careful taper is not optional. It is non-negotiable with this drug.
And here's a bit of a pro tip for you. If you have a patient who is just having a terrible time trying to come off Venlafaxine, there's a strategy called the fluoxetine bridge. What you do is you start them on fluoxetine,
Prozac, which has a super long half-life. Then, while they're on that, you slowly taper the venlafaxine. That long tail from the fluoxetine basically gives them a soft landing and can make the withdrawal way more tolerable. Mentioning something like this in a presentation, it shows you're thinking on another level.
Okay, before you even pull out your prescription pad, there are a few red flags you absolutely have to screen for. Think of this as your safety checklist, your due diligence.
First off, any patient with hepatic impairment, liver problems, the recommended dose needs to be cut by 50%. The liver is what breaks this drug down, so if it's not working at full steam, the drug can build up to dangerous levels. And it's a similar story for patients with renal impairment or kidney issues. The dose needs to be dropped by anywhere from 25 to 50%. The kidneys are what clear the drug from the body, so again, if they're not functioning well, you have to use a lower dose.
So let's recap your key safety checks. 1. Always get any pre-existing high blood pressure under control before they start. 2. Monitor that blood pressure regularly. 3. Be extremely cautious with anyone who has a history of heart disease. And then, like with any antidepressant, just be aware of that rare risk of flipping someone into mania if they have undiagnosed bipolar disorder or the small risk of lowering the seizure threshold.
All right, we've gone through the mechanism, the dosing, the side effects, all the warnings. So now let's boil it all down into one single elegant sentence, your pocket pearl that you can pull out on rounds to sound sharp.
Here it is. Venlafaxine is a powerful dual-action agent, where its main benefit, that noradrenergic kick at higher doses, is also directly linked to its main risks, hypertension and a difficult withdrawal. You see how that works? That one sentence connects the how it works to the how you use it, and that shows a really deep understanding of the medication.
So now you're ready. You have the whole framework to not just answer your attending's question, but to actually look at your patient list and proactively figure out who the right patient for this medication is and then manage them safely. So go on, take a look at your list. Which patient comes to mind?